When a woman comes to your practice with the diagnosis of endometriosis, are you immediately thinking of an anti-inflammatory diet or asking her about her fish oil supplements? If not, this video is for you. Hi, I'm Jessica Drummond. I'm a physical therapist and clinical nutritionist and the founder of the Integrative Pelvic Health Institute. My goal here is to teach you and update you about all of the current integrative therapies that can be useful in helping women with chronic pelvic pain, other pelvic health issues, and other women's health issues. So let's jump right in and talk today about the nutritional therapies that have been studied for endometriosis. I'm sure you see a ton of that in your practice because 80% of women with pelvic pain have an underlying diagnosis of endometriosis. It may or may not have been confirmed, but that's what they might show up in your clinical practice with, that diagnosis on their script. So endometriosis, we're learning more and more, is a chronic inflammatory disease, just like atherosclerosis, metabolic syndrome. It's an issue of inflammation gone awry. And as I've talked about in the past, inflammation is essential to the healing response, but at a certain point we've got to cut it off, stop it from getting out of control and being chronic and just going crazy. So in endometriosis, some of the research that has come out recently has shown inflammatory markers in peritoneal fluid and peripheral blood. So we see more inflammatory markers, inflammatory cytokines showing up when you take samples of women's peritoneal fluid and peripheral blood that have endometriosis. Researchers are even looking at chemokines, another pro-inflammatory marker, as diagnostic indicators for endometriosis. So this may show up in every woman that has endometriosis. And at a European meeting, I believe it was this past year, 2012, Dr. Taylor from Wake Forest University was talking about how they find in women that have endometriosis have increased nerve growth in the superficial endometrium. And it comes from this kind of influx of mast cells and other inflammatory cytokines that grow these nerves in that superficial endometrium. So that's more pain. So women with normal endometrium don't have those added, abundance of nerves that can potentially cause that increased pain. That connection hasn't quite been made yet, but that's possible. Now, we know that some anti-inflammatory drugs, like infliximab, for example, is not a silver bullet for healing endometriosis. So it's not just that we throw a medication at part of the inflammatory response to try to stop it that will stop endometriosis and the pain associated with it. So what I'm proposing is that we look at the data from nutritional studies. Now, to be fair, some of these studies are very small and not even peer-reviewed, but they start to give us a picture when we put them all together of how overall decreasing that inflammatory load, anti-inflammatory nutritional strategies can lower that inflammatory load. And in some of this data, we're seeing that the pain of endometriosis can be dramatically reduced. So that's so exciting. It could just come from food. All right. So the first strategy we're going to talk about that I say all the time in so many different ways because it's so true for all of these inflammatory pelvic health conditions, you got to get your patients off the sugar. So in a study that was published at Rutgers, someone's graduate work, she found that when you put a group of women with endometriosis on a low glycemic index diet, that means the combination of glycemic index for every meal and snack that the women ate was relatively low in sugar, their endometriosis symptoms decreased dramatically. Now, here's the problem. Of that small group of 13 women, only 9 of them were able to stick to that low sugar diet. So here's where our skills of coaching, health coaching, really come in to help patients be more compliant, feel really supported, and stick to a low sugar diet, because that's really hard in a country where the average person eats 152 pounds of sugar every year. All right, so low sugar diet decreases endo symptoms. The tricky part is keeping your patients on that diet. Number 2, test and eliminate for food sensitivities. And I say test, so my patient practice, my private practice, is called custom hormone healing because each woman is different and her food sensitivities are different. We have to start testing some of these things to be able to customize. The good news is you don't need expensive blood tests to necessarily do this. You can do it with elimination diets. That's actually the gold standard. But using some blood tests can also be helpful to confirm the elimination diet, or in women that just don't want to do the elimination diet, because it can be a little challenging. So what was interesting in this published case study of 2 women that had really difficult cases of endometriosis, they had had it for years, they had had several, I think at least 3 laparoscopic surgeries each woman. After laparoscopic surgery, they had been put on birth control pills to try to keep the surgery lasting longer. And the pain still kept coming back. Every couple of years, they would have to go back in for another surgery, more medication, pain coming back, pain coming back. And so, of course, their fertility, at least in one of the cases, was affected as well. So in this study, the researchers looked for specific food sensitivities, and each woman had 2 different lists, which I thought was super interesting. Some of the things were the same: sugar, baker's yeast, so cookies and baked goods. And some of the really common food sensitivities like milk, eggs, peanuts. Tomatoes are a common one I see in my practice for women with pelvic pain, the nightshade vegetables. And in this one, wheat. Notice wheat is not in this one, which is very interesting. And some other grains. So each woman had a different list of food sensitivities, but when they were dealt with, again, even there's these really difficult cases of endometriosis, the pain went away, and in one case the woman got pregnant. The other case, the woman had actually gotten pregnant previously in her life. So restoring pain, improving pain, and restoring fertility. This is so exciting. Okay. In the 3rd study, a group of Italian researchers took women who were diagnosed with endometriosis, although not confirmed with laparoscopy, and had them get off the gluten. They did not test them for celiac, which I actually would recommend, because women who have celiac disease have to be much more strict about really keeping the gluten out of their life. Gluten shampoo, 1/8 of a teaspoon of gluten can cause a problem if you have celiac. But they took these women off gluten in the diet, and those who stayed on the diet, the suggested protocol was to stay on the diet for at least 12 months. Again, compliance was a challenge. Bring in those health coaching skills. Work with the health coaches around you. Use your health coaching skills. To help these women stay off gluten for at least 9 months. They had 75% of these women had decreases significantly in their endometriosis symptoms. 75%! Now, that means not all of them, which is why this was super interesting to me. This woman's food sensitivities did not include wheat. So maybe there are some that just have different food sensitivities that we could bring this number even higher. All right, I'm going to give you a 4th bonus strategy. These are all these things you have to help your clients and patients take out of their diet, which I know is really a challenge. Here's something you can add to the diet, okay? So your 4th bonus strategy is to add something to your patients' and clients' diets that is high quality. Quality really matters when it comes to omega-3s. High quality omega-3 fatty acids, food or supplement. In a large study of over 70,000 women, there was a strong association between having endometriosis and eating a lot of trans fats in the diet. So trans fats are the yucco fats. Like, you don't want to see partially hydrogenated anything on a label in a woman's pantry who's struggling with endometriosis. Just throw that stuff out. So, because trans fats and endometriosis had a strong association. However, the risk of endometriosis decreases. That risk of endometriosis decreases when you increase the omega-3 fats. Again, an anti-inflammatory strategy. All right, so what did you learn today? What are you going to bring to your practice Number one thing for the women in your practice who are struggling with endometriosis, post it in the comments. Let me hear all about it. Tell me how you're going to use this in the clinic. Ask me any questions you have. If you like this video, please like it, share it with all of your colleagues and your patients. And again, my name is Jessica Drummond from Integrative Pelvic Health Institute, and I will see you next time.